Hello, and thank you for joining me for this Medicare Workshop video. My name is Renee Bellinger, and I'm a licensed agent and Medicare expert here at Blue Cross and Blue Shield of Minnesota in Roseville. In this video, you'll learn how and when to enroll into Medicare, what Medicare does and does not cover, and how to choose the right supplemental coverage for you. The video runs about an hour, and it will give you a great foundation of knowledge about Medicare. After this video, most people want a trusted person to support and guide them through this process. That's where we come in. Here at our Blue Cross Center in Roseville, my colleagues and I offer free one-on-one consultations to answer all of your questions and to recommend a plan that best fits your health and lifestyle needs. When you're ready, we can complete your enrollment into your Blue Cross plan and will continue to be an ongoing resource for you. If you ever have questions, you can reach out to us directly. All right, let's get started.
All right, well, let's start by looking at the topics that we're going to be covering here today. And this is really going to be split into two different parts. So we're going to start in the first part by covering Medicare basics. And here we're going to be talking about Part A, that covers you when you're in the hospital, and Part B is in Bravo. That's going to cover everything you do outside the hospital. Now, Part A and Part B together are commonly referred to as Original Medicare. And I want you to think of that as the base coverage. That's what everyone starts out with. And then in the second part of the presentation, we're going to go on and talk about the plans Blue Cross Blue Shield offers that supplement, that give you more coverage than what you're getting from that base Part A and Part B. And we'll also talk about why you might want to add more supplemental coverage, and then we'll go ahead and identify some key criteria for you to take into consideration when choosing which one of the supplemental plans is going to be most suitable for your particular needs. Well, let's start with the timing. So this is going to be when you're eligible for Medicare and when your coverage will actually take effect. Now, the most common way to qualify for Medicare is simply turning age 65. So those of you listening today that will be new to Medicare because you will be 65, the initial enrollment period is going to be important. Now, this period is going to include the month you turn 65, the 3 months before, and the 3 months after. So it is a 7-month window. Now, if you're collecting Social Security benefits for at least 4 months prior to turning age 65, then you will automatically be enrolled in both Part A and Part B Medicare. You'll get this red, white, and blue Medicare card in the mail around 3 to 4 months before you turn 65. Now, if you're not collecting those Social Security benefits, that's okay. You're still eligible for Medicare when you turn 65, but in that case, you are going to need to initiate turning those Part A and Part B benefits on. And you're going to do that by contacting the Social Security office. You're either going to call them or you can enroll on their website. And I'll have both the phone number and the web address on the next slide. Now, when you are eligible to contact Social Security, well, again, that's going to be during that 7-month initial enrollment period window. And as long as you're reaching out to Social Security during those first 3 months before you turn 65, then the effective date for both your Part A and Part B Medicare coverage will be the first of the month in which you turn 65. Now, if you wait to contact Social Security during your birth month or those 3 months that follow, that's okay. You're still in that initial enrollment period window. However, now the effective date for your coverage is going to get pushed out a little bit further. The next enrollment period we have is the special enrollment period. And there's a number of different events that may occur in your life that will open up a window of opportunity for you to either sign up for Medicare for the first time or in some cases make changes to that extra supplemental coverage that you've added on top of your Medicare benefits. Now, we won't have time here today to go into detail on all the different special enrollment events, but I will talk a little further about the most common special enrollment event that I see. And that would be people who turn age 65. So they are eligible for Medicare. However, they're working and they have a plan that their employer is offering and they want to stay on that plan. Well, you can do that as long as the employer coverage is what's called creditable. Now, creditable coverage just means as good or better than Medicare's coverage. And to find out if your employer is indeed offering creditable coverage, you can talk to someone in your HR department or whoever handles benefit administration at your company. Now, again, as long as it's creditable, you can stay working and stay on that employer coverage as long as you want. When you do finally decide to retire, that is going to create the special enrollment event. Now you can contact Social Security, let them know you're coming off of a creditable employer plan and you're ready to start Medicare. Well, two other enrollment periods to go through on this slide. First, to the bottom left, we have what's called the annual election period. And this is always going to occur every year between October 15th and December 7th. And this is the time when all Medicare beneficiaries are going to be reviewing their needs. And if they want to choose a different supplemental plan, they can do so during this period. Now, any plan you elect between October 15th and December 7th will then take effect January 1st of the following year. And then finally, over to the right, we have what's called the open enrollment period. Now, first of all, this period will only apply to those Medicare beneficiaries who have elected what's called an Advantage plan. Now, an Advantage plan is just a type of plan insurance companies offer that gives you more coverage than what you're getting from that original Part A and Part B Medicare. And we'll talk in more detail about Advantage plans in a little bit. But for now, just know if you did elect an Advantage plan, and then during the first 3 months of the year, you decide that plan isn't suiting your needs, or maybe your needs have changed, well, you actually get an opportunity to drop that plan and pick up something else. So think about this as a trial period if you choose an Advantage plan. All right, well, as promised on the next slide, I do have the phone number for Social Security and their website over to the right. And I've also included some helpful resources here with the Medicare helpline and the senior linkage line. Well, let's now look at the benefits that Medicare is offering. And these are, again, your original Medicare benefits. And we'll start over to the left with Part A. Now, Part A Medicare is primarily going to be covering you while you're in the hospital. Most Medicare beneficiaries do not have a monthly premium cost for Part A. They get it at what's called premium free. However, if you do start utilizing this benefit, there will be some costs. Now, let's take a look at that. Medicare is going to break this Part A inpatient hospital benefit into 3 different periods. The first period is going to cover the first 60 days that you're in the hospital. For those 60 days, you're going to have a $1,484 deductible. So you're going to be responsible for paying the first $1,400. After you meet that deductible, then Medicare is going to step in and they're going to pay 100% of all covered benefit costs for that 60-day window. Now, if you have a little more extended stay in the hospital, the next period gives you 30 more days of coverage. Those would be days 61 through 90. Now, for those days, you have a $371 daily copay. And the next period is going to give you 60 more days of coverage, days 91 through 150. And now that daily copay doubles from what it was during the last period. So you would be responsible for paying $742 every day. Now you'll notice in parentheses under those last period days, days 91 through 150, it says lifetime reserve days. And that means just like what it sounds like. You only get to use those days one time in your life. Once you use them, they are gone. So I want you to think of your Part A benefit as 90 days of inpatient hospital coverage per benefit period. All right, and a benefit period is going to start the day you go into the hospital, and it's going to end 60 consecutive days after you're out of the hospital. So let's look at a couple examples to help illustrate this. Let's say you go into the hospital for 2 nights, and then you go home, and 30 days, let's say, after you're home, you need to go right back in the hospital. And it could be completely unrelated to why you were there the first time. Well, in that case, you haven't been out of the hospital those 60 consecutive days, so when you go back in the second time, you're actually in the same benefit period, which means now you're going to be on day 3. So those days keep accumulating. Now let's look at another example. We'll start the same way, the same 2-night stay in the hospital, Only this time after you go home, it's not until 61 days that you've been home that you need to go back to the hospital. Well, that is going to generate a whole new benefit period. So in this example, when you go back in the second time, you're back to day one. You're also going to go back to having to meet that $1,484 deductible again. So you might have to meet that deductible multiple times in the same year, depending on how frequently you're in and out of the hospital. All right, well, let's go over to the right and talk about Part B Medicare. Now, Part B is going to cover everything you do outside of the hospital. So quite a few things covered by Part B. For example, office visits, whether to a primary care physician or to a specialist. This could be trips to the emergency room or urgent care. It could be an ambulance ride, durable medical equipment like canes, walkers, CPAP machines. This could be diagnostic tests such as x-rays, MRIs, CT scans. So again, a lot of different things covered under the Part B benefit. Now here, unlike Part A, where most people get it premium free, Part B, there is going to be a monthly cost. And it starts this year at $148.50 a month. Now it can go up to just over $504 a month. So pretty big range there of what you might be paying for that Part B benefit. Now Medicare is ultimately going to determine what you pay for your Part B based on your income. And quite simply, the more money you make, the more you're going to pay for Part B. Now they have set income threshold levels. So if you are single and your income exceeds $88,000, you're going to pay more than that $148.50. Married couples filing taxes jointly with an income that exceeds $176,000 are also going to have to pay more than that $148.50, and just how much more depends on how high your income goes above those threshold numbers I just gave you. Now there's also a deductible for your Part B services. This is relatively low. It's $203. So you're going to pay the first $203 for any covered Part B benefit cost. After you do, it becomes an 80-20 plan. That means Medicare is going to pay 80% of the cost, and you're going to be left paying the remaining 20%. So that is how your original Medicare benefits are going to work. Now, just as important as it is to understand what Medicare does cover, it's really important you understand what Medicare does not cover. So we'll start with the first bullet point, inpatient hospital days beyond Medicare's limits. Well, we know now that you get 90 days of inpatient hospital coverage per benefit period. And then you also get those 60 lifetime reserve days to use if you need them. But if you exceed that, there is no coverage with original Medicare. Routine physicals. So Medicare is going to give you 12 months from whenever your Part B is in Bravo Medicare starts to go get a Welcome to Medicare exam. And this one is a pretty thorough annual exam. However, they only give you that thorough exam one time. So every year after the first year you're on Medicare, you get what's called a wellness visit or a wellness check. And this one is pretty limited in scope. It's not going to cover much more than your height, your weight, and your blood pressure. Now, Medicare will step in and cover some bigger ticket kind of testing items like mammograms, colonoscopies, bone density tests, a lot of cancer screenings, but that actual office visit to go in and see your doctor is going to be limited to the wellness visit. Some other preventive services Medicare will not cover: a routine hearing exam, a vision exam, and most of your dental care. Medicare is also set up to cover you in the U.S. only. So for the most part, if you travel outside the U.S. and just have original Medicare, you will have no coverage. And finally, we talk about prescription drugs not covered by Part A or Part B Medicare. Well, let's start by talking about what is covered medication-wise by Part A and Part B. When you are in the hospital, any medication administered to you is going to be covered by Part A. Part B is in Bravo medications. Medicare is going to decide what a Part B drug is. Now, most of those medications covered under Part B, those are going to be infused drugs. So you have to go into a clinic or a hospital in some cases to have them administered to you. Most common example of a Part B is in Bravo drug is going to be chemo. Now, Now, the last thing I want to mention here about original Medicare is going to be up at the top in that green box, just to the right of the $sign. And that's where it says original Medicare does not have an annual out-of-pocket max. And that means if you exceed the number of inpatient hospital days Medicare covers, you're on your own and there is no limit to what you're going to be paying. With the services you're getting outside the hospital, covered under Part B, we know now that you're paying roughly 20% of the cost for those services. But the big question here would be 20% of what cost? Now, visits to a primary care physician might not be too expensive, but you start seeing some specialists. Maybe you take an ambulance ride, emergency care, some of your diagnostic tests like MRIs, CT scans, even your lab work. That kind of stuff can get very expensive, paying 20% of which, that can still be a very high number. And this is without a doubt the number one reason why people will come to me to get supplemental coverage, so that they can get that out of max in place, so that they can kind of have that worst case scenario. Now, all the plans we're going to look at next that Blue Cross offers are going to do just that. They're going to give you that out-of-pocket max. Well, before we get into the specifics of the Blue Cross Blue Shield plans, I just want to show you the different types of supplemental plans that are available. The first two listed, the cost plans and the advantage plans, these are going to be regional. That means the county you live in is going to determine which one of these plans you're actually eligible to enroll in. The next two, the Medicare Supplement, or what are often called Medigap plans, and finally the prescription drug plans, those plans are going to be available statewide. And as we progress through the presentation, I'll go into far more detail about how each of these plans works. A little bit of background about Blue Cross Blue Shield. We have been in Minnesota for over 85 years. That does make us the longest running health insurance company in Minnesota. We've been serving Minnesotans for over 4 generations and currently have well over 300,000 Medicare members. Now, that number represents over half of all eligible Medicare beneficiaries in the state. We're very proud year to year to have highly rated Medicare plans, and we are very committed to giving back to our local communities and charitable organizations. All right, well, the first plans we'll be discussing today will be our cost plans. And at Blue Cross Blue Shield, we call our cost plans Platinum Blue. Now, these Platinum Blue cost plans are unique in that they allow you a lot of nice flexibility. For example, if you just want to take the medical portion of a Platinum Blue plan, you can do that, and you can get a separate, independently working Part D drug plan. Or if you'd like the simplicity and the convenience of adding the medical and the drug together, combining those into one package solution, you can also do that. Now, these Platinum Blue plans are one of those plans I referred to earlier as being regional. And that means the county you live in is going to dictate whether or not you're eligible to enroll in one of these Platinum Blue cost plans. Now, the federal government has identified 21 counties in Minnesota where we can offer these Platinum Blue cost plans. Now, again, that's not a Blue Cross decision. That's the federal government telling us where we can offer these plans. So let's start there, and let's go over to the maps on this screen to the right. That top map of Minnesota is going to highlight the 21 counties where these Platinum Blue cost plans are allowed to be offered. So you do indeed need to reside in one of those highlighted 21 counties in order to be eligible to enroll in the Platinum Blue plans. However, as you'll notice that map of Minnesota right below, your network, the doctors that you can go see, that's going to be statewide and include 97% of all providers in the state. So you have a very large statewide network. Now, these Platinum Blue plans have low monthly premiums starting at just $29 a month. There are 3 different Platinum Blue options. And again, if you just want the medical portion of the Platinum Blue coverage, that's fine. But if you do want that convenience of adding the drug to the medical, we can combine that into one plan, giving you the convenience of having one card, one bill, a one package solution. The Platinum Blue plans are also going to provide a lot of nice extras like dental, vision, and hearing. Again, we do have that large statewide access. If you travel outside of Minnesota but within the U.S., we're going to extend coverage to all 50 states. And if you do travel outside the U.S., your emergency coverage will go with you. And finally, these are annual contract plans. and that just means every year the benefits can change. Well, speaking of changes, we have made some nice enhancements to our Platinum Blue plans moving from last year 2020 into this year 2021. First of all, your out-of-pocket exposure on both the Choice and Complete plans has been reduced. So that has been taken down by $500 on the Choice and $1,300 on the Complete. Your Tier 1 preferred generic medications will have no copay, no cost to you for those medications. We are going to include some new benefits this year as well, such as over-the-counter allowances, and that would be for things like vitamins and supplements. We're also going to include a nice acupuncture benefit, and we're going to include preventive dental on both our Choice and Complete plan options. Well, not really changes to these Platinum Blue plans, but definitely key features to be aware of. Again, that large network access covering 97% of all the clinics in the state. We have over 60,000 pharmacies in network across the U.S., and no referrals are needed. And that's a really key feature, because if you want to get a second opinion or go see a specialist, you can just pick up the phone and make that appointment. No need to get a referral. If you are traveling outside of Minnesota, as I mentioned, and within the U.S., coverage does extend to all 50 states, and quite simply on these plans, you can go see anyone that takes Medicare. Now, if you do travel outside the U.S., your emergency benefit goes with you. And that's a great benefit to have, but I do recommend to all my Platinum Blue members, if you will be traveling outside of the country, to look at adding travel insurance. And at Blue Cross Blue Shield, we have a great travel insurance program called Geo Blue. Now, we won't have time to go into the details on how that Geo Blue program works, but know that we have it, and if you're interested, you can contact us. We'll be happy to get you more info. All right, well, here we have our 3 Platinum Blue options. We have the Core, the Choice, and the Complete. Now, the first monthly premiums we're going to look at are just for the medical portion of the plan. So on the Core plan, it's $29, the Choice $94, and on the Complete, that's $164. Now, if you did want, as an option, to add that drug plan coverage and bundle medical and drug together, on that Core plan, if you look down from the second line item from the top, you'll see the monthly premium to add the drug coverage would be $25.80. That combined with the $29 for the medical, you'd be at $54.80 a month. On the Choice plan, to add that optional drug coverage, it would be an additional $40.50, which would bring you to a total of $134.50. And finally, on the Complete, it would be an additional $66.30 to add that optional drug coverage, and that would bring you to $230.30. Now, there is no deductible for any of your medical coverage, and we do have an out-of-pocket max. And this is really important because, remember, this is what original Part A and Part B Medicare do not offer. So on that Core plan, in addition to the $29 a month you pay to have the plan, the most you could spend on covered benefit costs in a calendar year would be $6,000. If you got to that point, you are now done. Now Blue Cross is going to pay 100% of all your covered benefit costs. On the Choice plan, that out-of-pocket exposure goes down to $3,500, and on the Complete, we take that down to $2,700. All right, well, on this next slide, we're going to look at medical benefits. So you have a medical benefit category listed over in that column to your left, and then you're going to simply slide over to the right to see what kind of out-of-pocket costs you would have to take advantage of those specific benefits. So first of all, primary care visits on the Core plan, $20 copay. On the Choice, $5 copay. And on the Complete, no cost to you. If you're seeing a specialist, like say a dermatologist or an orthopedic doctor, on the Core plan, you can see you'd pay 20% of the cost. On the Choice, you would have a $15 copay. And again, on the Complete, no cost to you. Now, on all the plans, your lab services are going to be covered in full. If you do need a diagnostic kind of test, like an X-ray, an MRI, CT scan, or radiology, you would pay 20% of the cost on the Core, whereas on the Choice and Complete plans, those diagnostic tests are covered in full, no cost to you. Ambulatory surgical centers are going to be places where you go for same-day surgery. Now, ambulatory surgical centers are not connected to the hospital. They're either their own freestanding building or they might be in a clinic. And you can see for those same-day surgeries, and examples of those would be like cataract surgery or maybe carpal tunnel. You'd pay a percentage of the cost for that on the core, on the choice a $50 copay, and on the complete that would be covered in full. Now, if you're in the hospital, classified as an outpatient, that typically means you're getting that same-day type of surgery, and you can see it's the exact same copays and coinsurance for those outpatient hospital surgery visits as what it is with the ambulatory surgical centers. If you are in the hospital and categorized as an inpatient, well, then on the core plan, you would have a $600 copay, and that would cover the entire time you're in the hospital. On the choice plan, that would go down to $200, and on the complete, it would just be a $100 copay, and again, that would cover all the days that you were in the hospital. Emergency and urgent care, you can see there's copays associated with those services. And finally, we finish up on this slide with Part B, is in Bravo medication. Now remember, the most common example of a Part B drug would be chemo. On the core and the choice plans, you're going to pay 20% of the cost for those Part B drug administrations, and that would be up to the out-of-pocket max we looked at on the last slide. On the complete plan, it says between 0 and 20%, and it's really going to be either or. You're either going to pay nothing for those Part B drugs, or you're going to pay 20% of the cost. Now, if you're having a Part B drug administered to you in a clinic or a hospital setting, which is typically how those drugs are administered, then you will pay nothing. If, however, you take home and self-administer a Part B drug, that's where you'll be responsible for that 20%. All right, well, if you do decide to add that optional drug plan, let's look at how that works. So first of all drug plans are going to have a formulary. Now, a formulary is just a list of the drugs that the plan covers. All drugs covered by the plan are going to be categorized by tier levels. And these Platinum Blue plans have 5 different tier levels of medication. The first 2 tier levels are primarily going to be your generic drugs. Tiers 3 and 4, you're going to be getting into your brand name medications. And finally, tier 5, those are going to be your specialty drugs. Now, on the core plan, you'll have a $445 deductible to meet before you get into the cost sharing with Blue Cross. On the choice and complete plans, there will be no deductible for tier 1 or tier 2 drugs. If it is tier 3 through 5, that $445 deductible will apply. Each of the plans, you can also notice, has 2 columns underneath them: preferred pharmacy and standard pharmacy, and that's referring to pharmacy type. So all those 60,000 pharmacies that we cover across the country are either preferred or standard. Now, examples of preferred pharmacies, that's going to be your CVS's, Target's, Cub, Costco, Sam's Club, Walmart, Thrifty White, just to name a few. Your big standard pharmacy, that's going to be Walgreens. Now, Walgreens and other standard pharmacies are going to be covered, but you can see you're going to have a higher copay for the same medication at a standard pharmacy as opposed to a preferred pharmacy. Now, although drug plans are always administered by insurance companies, Medicare actually sets forth the rules these drug plans need to follow. And one of those rules is called the coverage gap, or what you'll commonly hear referred to as the donut hole. Now again, the numbers I'm about to talk about are going to apply to every drug plan in the country. So here's how this works. Once what you have spent on your medication and what the insurance company is subsidized, when those 2 numbers together reach $4,130, you are in the coverage gap. That means now, instead of paying according to that cost-sharing chart we just looked at, now you're going to pay 25% of the cost for all covered medications. And you'll continue to pay that 25% until what you and you alone have spent on your drugs reaches $6,550. If you get to that point, you have now reached what's called catastrophic coverage. Now you're going to pay $3.70 for covered generics, $9.20 for covered brand name drugs, or 5% of the cost of your medication, whichever number is greater. And you'll continue to pay according to that catastrophic coverage schedule until the end of the calendar year, at which point the slate is wiped clean and you start over. Now, if this is beginning to sound a little complicated, believe me, you're not alone. But there is a way to cut through this and make it a lot easier to look at how your specific medications will be covered. and that's by running what's called a drug calculator. We have those calculators available on our Blue Cross website, or if you're working with an agent, they can help you through that as well. Well, next, let's look at some of the extras that these Platinum Blue plans are going to offer. We've talked about medical, drug. We're also going to have, again, some nice extras. So first of all, over-the-counter items. We're going to give our members $25 every quarter for over-the-counter items, and these would be things, again, like vitamins, supplements, maybe Band-Aids or bandages. Silver Sneakers is a great benefit all of our plans are going to come with. How that works is whatever Blue Cross Blue Shield plan you decide to enroll in, the monthly premium you pay to have that plan is going to cover a gym membership in full as long as that gym participates with Silver Sneakers. Now, there are currently over 16,000 participating Silver Sneakers gyms across the country. You can join any one of them. And there is no limit to the number of gyms that you can become a member of. So if you like to use the YMCA's pool in the morning and then maybe go to a Lifetime Fitness to work out in the afternoon, that's perfectly fine. And there is no minimum number of days you need to go to the gym to maintain this benefit. Silver Sneakers also has developed some great home workout programs you can take advantage of as well. Acupuncture, this is a new benefit this year. Medicare is actually going to cover 20 visits for acupuncture, but it has to be related to back pain. So you're going to get that, but you're also going to get from the Platinum Blue plan an additional 20 acupuncture visits for any other kind of pain. Physical exams are going to be covered in full on all the Platinum Blue plans, no cost to you, and this is going to go above and beyond that kind of flimsy wellness check that Medicare offers. So all our Platinum Blue members get that full annual physical covered in full. On our Choice and Complete plans, we are going to offer preventive dental, which means you get 2 exams, 2 cleanings, a set of x-rays, and a periodontal cleaning every year. The Choice and Complete plans are also going to extend 2 vision exams to our members at no cost every year with some nice reimbursements on eyewear. And finally, we will also give all of our Platinum Blue members a hearing exam covered at no cost with some nice discounts on hearing aids. The next plans we're going to be talking about today are the Medicare supplements, or what are commonly referred to as Medigap plans. Now, with these plans, Medicare is actually your primary insurance. That means all administration of benefits and all claims start at the Medicare level. Now, Medicare is going to pay on those claims based on the benefits we looked at a little earlier in the presentation. Then the claim is going to work its way to us at the insurance company, and we're going to fill the gaps. Now, these Medicare supplement plans can only be medical coverage. Some of the other plans we've looked at today, you can combine medical and drug into one plan. Not the case here. These are only medical plans. So if you want to have, say, a drug plan, you have to purchase a separate, independent drug plan. These Medicare supplements or Medigap plans are also going to have some other unique features that set them apart. Let's take a look at that next. So first of all, the benefits on these Medigap plans are guaranteed to renew. That simply means as long as you pay your monthly premium, you're going to keep the same benefits year to year. The other plans we've talked about today have annual contracts, so those benefits can change. Not the case on these Medigaps. Guarantee issue. This is going to be a really important concept for you to understand. How this works is you get 6 months from whenever your Part B is in Bravo Medicare starts to enroll in a Medigap plan and have a guarantee issue. That means you fill out the application and you're into the plan. Now, if you enroll after that 6-month period, then there will be health questions that go with the application, which means our underwriters are going to get involved. They're going to look at any pre-existing conditions, and they do have the right to deny you coverage. So I always like to tell folks, especially when they're new to Medicare, the best time to enroll in one of these Medicare supplement plans is when you're first eligible, because that may be the only time that you're going to have that guarantee issue. Now, these plans are not regional. They are available to all Minnesota residents. And these plans are also completely portable, meaning wherever you go, the plan goes with you. Even if you move outside of Minnesota and have residency in another state permanently, these plans will still go with you. Again, these are medical coverage only, and that does give you the ability to then choose any standalone drug plan available to you in Minnesota. The network for these plans is going to be anyone that takes Medicare, and that's not just in Minnesota, but that's going to be across the whole country. So you have a very large nationwide network. If you do travel outside the country, your emergency coverage will go with you. These plans, like all the others we've talked about today, come with Silver Sneakers, that great gym membership. We also do offer local customer service, a 24-hour-a-day, 7-day-a-week nurse line. Blue 365 is a great program that offers discounts on health-related items. These might be things like glasses or hearing aids. And we do also offer wellness programs and health coaching to all of our Medicare Supplement members. All right, well, here we have the 3 Medicare Supplement or Medigap plan options: the high deductible plan, Plan N, and basic Medicare Blue. Now, you'll notice first with the premiums, there's 2 different premiums. The first one, tobacco-free, is if you're not a tobacco user. The second, standard premium, is going to apply to anyone who has used tobacco in the last 24 months. So a little bit higher premium if you are a tobacco user. The high deductible plan, $70.70 a month. That's the tobacco-free rate. And then you do have a deductible that's set at $2,370. So on this plan, you would simply be responsible for the first $2,370 in any covered benefit costs. If you get to the point of meeting that deductible, now you're done. Now Blue Cross is going to step in and pay 100% of your covered benefit costs. Plan N, this one works like a copay plan. Now your tobacco-free rate here monthly is $198.55. And before you get to the copays, you do have to satisfy Medicare's Part B deductible, which remember applies to any services you get outside the hospital, and that's $203. After you satisfy that deductible, there's 3 benefit areas where you would have copays, and I'll show those to you on the next slide. And then finally, we have what of these 3 plans amounts to the most popular, the basic Medicare Blue. This one is $231.40 a month. And on this plan, just like that Plan N, you will be responsible for satisfying that Part B deductible of $203. But on the basic Blue plan, after you meet that deductible, as long as it's a Medicare eligible service, there will be no further cost to you. Well, on the next slide, we talk about specific benefit categories, but we've really explained how these plans work, and I want to go through that one more time. On the high deductible plan, you are simply responsible for the first $2,370 in any covered benefit costs. Once you get to that point and satisfy the deductible, there will be no further costs for Medicare eligible services. Plan N, the copay plan, remember you do have to meet that $203 Part B deductible. After you do, 3 areas where you'll have copays. Those would be for office visits at $20, emergency room visits $50, and finally urgent care $20. And then finally on basic Medicare Blue, again, you're responsible for meeting that $203 Part B deductible. After you do, no further costs for Medicare eligible services. Now I do want to talk in more detail about the second line item from the top where it talks about preventive benefits. And you'll notice under the high deductible and Plan N, it says not covered. Well, keep in mind with these Medigap, these Medicare supplement plans, Medicare is your primary insurance. So if it's a service Medicare does not cover, for the most part, then these plans will not cover it either. Now, at the beginning of the presentation, we talked about some preventive services Medicare does not cover. For example, an eye exam or a hearing screening. So because Medicare doesn't cover those, the high deductible plan and the Plan N does not as well. Now, the basic Medicare Blue plan is actually going to give you $120 every year towards those preventive services Medicare does not cover. So now you've got that $120 to use, for example, towards an eye exam or a hearing screening. All right, well, that's everything on the supplements. Those are pretty straightforward plans. We will move next into the Medicare Blue Rx standalone drug plans. Now remember, a lot of the plans we talked about today come with drug coverage. But if you have that Medigap plan option we just talked about, there is no drug coverage, so you'd want to look at one of our 2 standalone drug plan options. And those would be the standard plan at $66.40 a month, or the Premier plan at $104.70 a month. Now on the standard plan, There will be no deductible for Tier 1 or Tier 2 medications. If you do have a Tier 3 through 5 medication, you will be responsible for the first $445. And over on the Premier plan, we got rid of that deductible altogether. Remember, we do have a formulary for each plan, and they're all different. And on the formulary, all the drugs that we cover on these plans will be classified by those 5 tier levels. The first 2 being primarily generic drugs, Tiers 3 and 4 being primarily brand name drugs, in Tier 5 specialty. Same preferred and standard pharmacies as what I talked about earlier. So again, examples there of preferred pharmacies. You've got your CVS's, Targets, Walmart, Cub, Costco, Sam's Club, just to name a few of those. And the big standard pharmacy on these plans would be Walgreens. Again, Walgreens or any other standard pharmacy is covered, but you pay a little bit more for the same medication at one of those standard pharmacies as opposed to going to a preferred pharmacy. Well, that coverage gap or donut hole that I discussed earlier with those other plans, that still does apply as it does to all drug plans in the country. I won't go through those details specifically, but I will point out that our Premier plan, that one that's just over $104 a month, has a slight exception to how the coverage works when in the coverage gap. So on that Premier plan, if you do indeed get into the coverage gap, any of your Tier 1 and Tier 2 medications filled at a preferred pharmacy will be at no cost to you, as opposed to having to pay 25% of the cost like you would on any of the other plans that we looked at today. Now, whether or not that Premier plan is going to be suitable for your needs, well, we can run that drug calculator that I mentioned, and that'll help us determine which plan is going to make most sense for you. The Part D late enrollment penalty. So if you do not enroll in a Part D drug plan when you are first eligible, and then later down the road decide to pick one up, Medicare is going to penalize you. Now, the penalty is going to be 1% of the national average cost of a prescription drug plan. That's around $50 a month. So 1% of $50 is 50 cents, and then you're going to multiply that by the number of months you could have had a drug plan, but you didn't. Now, whatever that calculates out to be, you're going to be paying every month on top of the cost of whatever drug plan you enroll in. And you'll always be paying that penalty every month as long as you have a Part D drug plan. Now, if you never take a Part D drug plan, you'll never have to worry about the penalty. But always like to advise people that is out there. A lot of folks new to Medicare, especially if they're not taking any medications or maybe very inexpensive medications, might wonder, why should I take a Part D drug plan? And this would be one answer to that, to avoid the penalty down the road. So just be aware it's out there. Well, medications can be very expensive, and I want you to know there is extra help to pay for the cost of medications. To find out if you qualify for any of this extra help, you can either contact Social Security or Medicare, and I have those phone numbers listed for you on this slide. Well, that basically brings us to the end of the content I wanted to cover with you today. I do have 3 more slides that Medicare requires I show to you. What to expect when you enroll. You're going to get a welcome letter, a welcome packet, and an ID card, and I can go into far more detail with you if you do decide to take a Blue Cross Blue Shield plan. The next couple slides, again, just give you more important information. Remember, if you'd like a copy of these PowerPoint slides, I'd be more than happy to send these out to you.
Thank you for tuning into the Medicare Workshop video. I hope it was helpful and informative. When you have questions, don't hesitate to reach out to us. We're here to help. One last reminder, if you know anyone who is turning 65 or about to retire, you're welcome to share our contact information or invite them to attend a Medicare workshop like this one. Thanks again and take care.